Shift siya sa AirPods. Wait, I don't know kasi kung okay. Hopefully it's right now. Can you see now the slides? The
Yes
slide?
po, Doc. Yes po.
Nakikita niyo na? Okay. Okay. So, actually, hindi ko nakikita yung mga comment nyo, so I have to use another phone. Ang hirap pala, no? Anyway, so today we'll be discussing about elimination disorders. Nagbasa ba kayo? Yan ang tanong eh. Very short lang siya. Pinahahaba ko lang. But for the sake of recitation, anyone who can give an input regarding elimination disorder. Before you speak, you say your surname. Okay? Sinong gusto mag-volunteer? Unang magpa-volunteer.
Doc Robert Dizon po.
Ay, wait. Parang hindi ko magana yung AirPods ko. Wait. Hindi kita naririnig. Sige nga.
Hello po, Doc.
Sige, game.
Si Robert Dizon po. For elimination disorders, most probably this is inappropriate elimination of urine or feces usually seen in childhood and the adolescence. From what I remember, this is I think enuresis and encompressis. And yun po.
Tama na, Robert. Thank you. Anyone else na may input? Robert Dizon. Aside from Dr. Dizon, anyone else? Wala na.
Hello po. Good morning po.
Yes, good morning.
Yumal po, Stephanie po. I think one of the yung naalala kong criteria here is yung elimination po would happen in inappropriate places and pwede po siyang either involuntary or intentional.
Okay. Others?
Doc, Ochoa po.
Ochoa. Queenie.
Doc, based po dun sa WTSM po, yung diagnosis daw po ng mga elimination are not made until after age of 4 years for yung encompress po and after 5 years po for enuresis po. At yung ages po na yun typically developing po kasi yung child para ma-master yung skills na to.
So, dapat na-develop na by that age. Kaya, disorder na siya if it persists after that. Okay, thank you, Queenie. Who else?
Doc Ricardo po.
Ricardo. Okay.
Both naman po siya is self-limiting naman po but needs toilet training po by the parents po.
Okay. Laila, tama ba?
Lila po.
Lila. Sorry. Okay, Lila. Okay. Other thoughts?
Doc, kahigas po.
Kahigas. Okay.
Kahigas po.
Ay, kahigas. Okay. Kiza.
Ayun na. For enuresis po, the behavior na po must occur for at least twice weekly for at least 3 months para po ma-diagnose as enuresis.
So there's an element of duration, no? Or how often. Tama. At least, titignan nyo na yung DSM, no? Okay. So, let's proceed. Sige, mamaya, magtatawag pa ako. So, okay. So, for an introduction, of course, you have to understand what's the typical sequence how a child develops control over bowel and bladder. Okay? So, it starts with the development of the nighttime fecal continence. Yun muna yung nade-develop. Then, yung diurnal or daytime fecal continence. Then, later on, made-develop na yung day bladder control niya. Ang last na nade-develop, yung nighttime bladder control. No? So, normal yan. Nakikita nyo yan sa mga children. And most children achieve yung final stage by the age of 36 months. So, yun yung most. So, kaya nga may adjustment before you consider it as a disorder. Okay? So, toilet training is affected by the following factors. Of course, yung intellectual capacity ng isang bata, yung social maturity niya, of course, as the brain matures, nade-develop yung systems of control. No? Cultural determinants. So, depende yan sa when culturally, no, the child is toilet trained. No? And other factors, which is more important, yung psychological interactions between child and parents. Of course, who does the toilet training? Siyempre, yung parents. No? So, depende doon sa interactions nila. Made-develop yung child to be toilet trained. Okay? So, I don't know if I can hear you. Magsalita nga kayo. Kasi nagsishift yung aking AirPods. Okay.
Doc, hear you naman.
Yan. I can hear you now. So this is the two. Actually, very short tong chapter na to. Papahirapan ko lang talaga kaya pinapahaba ko lang. So, dalawa lang siya. Encopresis and enuresis. So, sinabi nyo na yon yung definition. So, it is not diagnosed, no? After age 4 years and 5 years respectively, no? Ay, mali. Before the age, no? Not diagnosed before the age of 4 and 5 years respectively. So, mas nauuna talaga yung bowel control, no? And this is troubling to children and families, of course, diba? Pag nag-bedwet ang bata, ang daming affected, no? Their beddings, no? Or, of course, yung marami siyang functional consequences. And it is often misunderstood as voluntary misbehavior. So, ito yun. So, again, I show you the diagnostic criteria. You have to just remember. So in encopresis, there's repeated passage. Into inappropriate places. So, sa damit, sa floor, they may say it's involuntary or intentional. And tama yan, may duration. Each month, no, one event occurs each month for at least 3 months. So, buwan-buwan. Madalas, no? And the chronological age is at least 4 years, no? And the behavior is not attributable to, yan, meron na naman tayong ganyan, no? Not attributable to physiologic effects of a substance or another medical condition, except to a mechanism involving constipation. So there's a specifier here. We can say if it's with constipation and overflow incontinence or wala. Okay. Later on, I will discuss this overflow incontinence. Okay? So, yan yung definition, no? Sabi dito, they may be present in children who have bowel control and intentionally deposit their feces in their clothes or other places for a variety of emotional reasons. So some may be attributable to an expression of anger or rage in children, lalo na kung punitive, no, or hostile yung parent, no. And some occur in times of stress, no, like for example, birthing of a new sibling, okay. And when it is involuntary, it is often related to constipation, impaction, retention, and pag syempre nag-retain na yung feces, no? Of course, kumakain naman yung bata, may mga subsequent overflow, no? nagsusoil, no? Anywhere, no? Okay? So, constipation may develop for psychological reasons, no? For example, they are anxious about defecating in a particular place, no? O kaya meron silang mga oppositional, no, behavior, no, or kaya parang ayaw nila mag defecate, and there's excessive volitional stool retention. Okay? Physiological predispositions to constipation include, ito naman talaga yung nangyayari, ineffectual straining or paradoxical defecation dynamics, no? With contraction. So, parang hindi siya yung regular na marirelax, no? Nagka-contract pa lalo, no? Of the external sphincter or the pelvic floor, no? And may be attributable, of course, with the dietary habits. For example, if they insufficiently take fluids, o kaya meron mga disease such as celiac disease, hypothyroidism, or medication side effect, no, can also induce constipation. Okay, so sabi, yung fecal consistency may be normal, near normal, or liquid, no? And yung pagsosoil nila, yung ibig sabihin nasa underwear nila, may occur from chronic retaining of stools. No? O kasi kakatitain nila ng stools, no? So yung liquid doon, nag-overflow. Would you know the Tagalog word for soiling? Meron ba nakakaalam? Yung liquid overflow. Ewan ko kung aware kayo, yung nagpupugpet, yun. So, yun, lumalabas kahit saan or nagsusoil sa mga clothes, no? In rare cases, involuntary overflow results from physiological causes of diarrhea or anxiety disorder symptoms. No? And children with enteropresis who do not have GI illness have high rates of abnormal anal sphincter contractions. So, yan yung mga prevalent shadows with yung specifier natin. Constipation and overflow incontinence. Kasi nga, difficult sila mag-relax ng anal sphincter nila, muscles, when trying to defecate. Okay. So, syempre, when you have these, ano ba yung mga associated features? Syempre, yun siya, they feel ashamed, no? At saka they may wish to avoid situations that may lead to embarrassment. So, ayaw na nila umattend ng mga activities na with longer duration. No? Okay? And impairment is a function of child's self-esteem, degree of ostracism by peers. Of course, di ba? Kung saan ka datna, no? Of course, siyempre, may effect yun, no? You will be ostracized by peers, no? The anger, punishment, and rejection on the part of caregivers. Naturally, kung nagsusoil, ang hirap maglaba, no? Minsan papagalitan pa, no? So, ito yung mga nagkukos ng impairment sa bata. And smearing feces may be deliberate or accidental. Meaning, halimbawa, ikini-clean up na nung bata. So, nagsismear na, no? And when continence is clearly deliberate, yes, baka consider din natin if these are features of a positional defiant disorder or conduct disorder. Okay, so prevalence. Now, majority of the children older than 4 years old have subtype, yun yan, constipation and overflow incontinence. No? Okay, so it affects 1 to 4% in high-income countries. Tapos mas mataas pa sa Asian countries, no? Sa Iran, South Korea, Sri Lanka. And more prevalent, yan, the younger, no? Among 4 to 6 years old. Kasi baka na-late lang in development nila ng bowel control. And the prevalence, interestingly, is higher among children who experience early abuse or neglect and low-income youth. Okay. So again, it is not diagnosed until a child reaches chronological age of at least 4 years old. So other factors, kung inadequate ang toilet training or may psychosocial stress, they can be considered. No? Yes. So etiology is functional. No? Ito yung nangyayari. Children withhold feces by contracting their gluteal muscles, holding their legs together, and tightening their external anal sphincter. Or in some cases, behavioral response siya, lalo na if the child experience painful bowel movements. Kasi di ba, very noticeable to when the child takes in food, di ba? May mga episodes na um, hard yung stools nila. Actually, may mga milk talaga, formulas that can induce hard stools, no? So, nangyayari yon because of the fear, no? The fear na may painful bowel movement, no? Nagkakaroon ng fear of defecation and withholding behaviors. Okay? And other factors, yung inadequate toilet training or lack of appropriate toilet training may delay a child's attainment of continence. O kaya, talaga naman yung merong ineffective sphincter control. Okay. So, 5 to 10%, those with fecal incontinence, they are caused by abnormal innervation of the anorectal region or the Hirschsprung disease, neuronal intestinal dysplasia, or spinal cord damage. So this would be a differential diagnosis, of course. And they are higher among children with known sexual abuse and other psychiatric disorder compared to healthy children. So may type pa siya, is it primary or secondary? So pag primary, wala siyang na-develop na continence, no? Ibig sabihin, tuloy-tuloy, hindi talaga na-develop. Pag secondary, there's a time na nakontrol niya na. Tapos biglang there's an episode na nangyayari yung encopresis, no? So secondary yon. And kung meron na siyang sphincter control, tapos nangyari pa yung encopresis, this may reflect a regressive developmental behavior, no? Based on a severe stressor, pwede mong tingnan yung mga factors like parental separation, loss of a best friend, or unexpected academic failure. Tapos meron sa plan, no? They discuss the megacolon, no? Baka ito yung later course, resulting chronic rectal distension from large, hard fecal masses can cause loss of tone in the rectal wall and desensitization to pressure. Kaya parang yung child, di siya aware na puno na, no? And that they need to defecate. Kaya nagkakaroon ng overflow and compresses. Yung liquid nag-flow, no? Sa kanilang underwear. Usually, yan, with relatively small amounts of liquid or soft stool leaking out. So, ang hirap nitong problem na to kung nangyari. Buti na lang konti lang talaga. No? So, wala pa nga ako nakita eh. No? So, what are the risks and prognostic factors? No? Yan. So, painful defecation can lead to constipation and a cycle of withholding behaviors. Male gender, no? And age prior to adolescence. So, these are factors, no? Risk factors. And if the child has anxiety, depression, or behavioral disorders, or their psychosocial stressors, and lower economic status. So, what are the diagnostic markers? So, wala. No? Diagnosis is based on history and PE lang. No? So, you have to do history about toilet training and the factors associated with it. No? And we do the digital rectal examination. And if you do that, there's detection of rectal fecal induction. And of course, you do abdominal examination to determine whether fecal retention is responsible for encopresis with constipation and overflow incontinence. Okay? So you do abdominal radiograph para lang makita if there's fecal impaction. And for more advanced, no, you can do anorectal manometry, no, para makita nyo kung meron Hirschsprung disease. The differential diagnosis includes medical illnesses, ito yon, Hirschsprung, ganglionic megacolon, and anal fissures. Okay? Other rare conditions include structural disease of the anus, rectum, colon, or adverse drug effects or non-GI disorders. No? So ito yon. Ito yung mga differential diagnosis. Chronic diarrhea, spina bifida, and stenosis. Okay? Treatment. Okay. So what is the treatment? Okay. Meron sinasabing oral administration of laxatives. No? Ito yan, PEG. And often surgical disimpaction under GA. Kasi nga mga bata to no? Before administering maintenance laxatives. Okay? So, cognitive behavioral intervention to help the child begin regular attempts to have bowel movements in the toilet to diminish anxiety related to bowel movement. Okay? So, CBT, na para lang matulungan yung bata na kung ano man yung mga distorted thoughts niya about bowel movements or the pain, yun yung i-address. No? And by the time the child presents for treatment, tingnan nyo to actually marami ng problems in the family kasi they experience a lot of discord and distress. So what we do, we must reduce family tensions about symptoms and of course establish a non-punitive atmosphere. And we should help reduce child's embarrassment at school. Okay? We should help reduce child's embarrassment at school and arrange for many changes of underwear with a minimum of embarrassment. So, papaunin niyo na ng mga gamit para hindi na siya mahihirapan. Okay? So, education of family and correction of misperceptions that the family may have about soily, important yon. And regular timed interval on toilet may be useful. Pwede natin i-suggest yon. So, instead na magsusoil sila anywhere, meron na lang regular timed interval na tuturuan yung bata when they can pass the stool. Okay. Very important, of course, is the interactive parent-child family guidance intervention. So, yun talaga yung pagtutuunan nyo kasi yun yung mga factors that makes it difficult for this to handle. And others, supportive psychotherapy and relaxation techniques, of course, to address the anxieties, and the other sequelae of compressives. Kasi nga, di ba, it will result into low self-esteem, social isolation. So, yun yung i-address natin. And the optimal outcome, what we want to achieve when we treat them is the child achieves a feeling of control over his or her bowel function. So that's it. About encopressives. Diba? May tanong kayo. May tanong kayo sa encopressives? Kasi if wala, we proceed with enuresis. So, ang enuresis naman, urine naman. Repeated voiding of urine into a child's clothes or bed, and voiding may be involuntary or intentional. So, again, dapat 5 years old na siya kasi usually nade-develop na siya at age 4. And children are the higher risk for ADHD compared to general population. Okay. So, ano yung mga types? Sa gabi lang, nocturnal only, daytime lang, diurnal only, or kahit anong time. Okay? So, ano naman itong mga batang to, pagka nag-suffer sila ng ganitong disorder. So, what is the diagnostic criteria? Yan, ito yun. So, ang important dito, manifested by either frequency of at least twice a week for at least 3 consecutive months, or the presence of clinically significant distress, again, in social, academic, or other important areas of functioning. And again, it is not attributable to the physiologic effects of a substance. For example, kung nagda-diuretic, no, or an antipsychotic medication, or other medical conditions such as diabetes, spina bifida, and seizure disorder. Okay? So, ito yun. So, di ba, pag nakita nyo yung criteria, maalala nyo kaagad. Okay. Alam nyo na yung itatanong nyo when you have patients like this. Then, so, of course, passing urine involves complex neurobiologic systems that include contributions from cerebral and spinal cord centers, no? Motor and sensory functions, and autonomic and voluntary nervous systems. So, of course, your neurons regulate urination in pons and in the midbrain region. Okay, so yung bladder death restore muscle contraction occurs whenever bladder capacity is reached, which can lead to enuresis in a sleeping child. But, yun nga, healthy bladder control, siyempre na-acquire naman siya gradually. So, influensya ng neuromuscular, cognitive development, social-emotional factors, toilet training, and genetic factors. So, yan. So, yan yung mga titingnan ninyo, no, na mga areas ng child development. Okay? And difficulties in one or more of these areas can delay urinary continence. So, ito din, katulad din ng encopresis, no, may mga maaring psychosocial stressors, for example, related to the birth of a sibling, hospitalization, start of school, no, separation of family due to divorce, or a move to a new environment. So you have to ask this, no, if there are factors such as these. So, what are the associated features? Sabi daw, during nocturnal enuresis, the voiding takes place during REM sleep, no? And they may recall a dream that involves the act of urinating, no? Kaya yun ang nangyayari. And during daytime or diurnal enuresis, the child defers. Ayaw niya mag-void until incontinence occurs. No? Sometimes, because of a reluctance to use the toilet as a result of social anxiety, or preoccupation with school or play activity. Alam niyo yun, may mga bata na sobrang anxious in school na they cannot even tell the teacher that they have to urinate. No? So, ano nila yun, de-defer nila yung voiding until hindi nila kaya. Okay? So, the enuretic events most commonly occur in the early afternoon or school days, or after returning from school. So the prevalence, okay, the prevalence of daytime incontinence ranges at 3.2 to 9% in children ages 7 years old. So mas malaki talaga pag mas bata, no? And meron pa ring 1.2 to 3% in adolescent ages 15 to 17. Okay? Prevalence of nocturnal enuresis in the community decreases with age, yan, in several geographical settings. 5 to 10 among 5 years old, 3 to 5 among 10 years old, and around 1% among 15 years or older. Kawawa naman yung 1% na yan. And boys, no, boys and members of socially oppressed groups may have higher prevalence. Sabi sa DSM, 5TR yan. Disorder may have a higher prevalence in youth with learning disabilities or with ADHD. Okay, so what are the types? No? Merong primary, merong secondary. Again, ganun din, no? Kung hindi pa establish ang urinary continence, primary. Kung secondary naman, no, baka establish na sila ng urinary continence, tapos biglang suddenly, they develop this disorder. And it begins between ages 5 and 8, but it may occur anytime. After age 5, no, usually the rate of spontaneous remission is 5 to 10% per year. Okay. Again, kawawa talaga itong 1%. Ano? And the urinary enuresis is uncommon, no, after age 9, but common in those who also have co-occurring mental health problems. So talagang pagka tumatagal na, nare-refer na yan sa atin. The significant emotional and social difficulties of children usually include, again, poor self-image, decreased self-esteem, social embarrassment, and restriction and intrafamilial conflict. Okay? So ano ba yung mga risk and prognostic factors? Of course, risk, those with developmental delays and neuropsychiatric problems. Okay, those with delayed toileting and psychosocial stress. This yan. You have to find that out in your anamnesis. Okay, or if there's mismatch between nocturnal urine production, nocturnal bladder storage capacity, and the ability to arouse from sleep, yan yung mga factors, kung may mismatch dyan. And they say, if there's a family history of enuresis, merong high risk that the child will develop enuresis too. And nocturnal enuresis is more common in males than in females, 2:1 ratio. Okay? And the urinary incontinence is more common in females than in males, and the ratio increases with age. So sa mga lalaki, nocturnal, sa mga babae, the urinal. Okay? So what are the functional consequences? Naturally, there's impairment. Not the impairment is a function of the limitations of child social activity. So, syempre, hindi sila maka-attend ng mga camps because that might happen, or it may affect child self-esteem. Again, degree of social ostracism by peers. And again, the anger, punishment, and rejection on the part of the caregivers. Imagine nyo na lang, palit ng bed linen, laban ng clothes because they keep on urinating inappropriately. Again, for the diagnosis and the differentials, no single laboratory finding is pathognomonic. And of course, you have to rule out organic factors. Common yung UTI and structural abnormalities. So again, yan yung mga differential diagnosis, UTI, obstructive uropathy, spina bifida occulta, cystitis. And of course, in diabetes mellitus and insipidus, there's polyuria and urgency. So you have to rule that out. Or if there are disturbances of consciousness and sleep, such as seizures, intoxication, sleepwalking disorders, or adverse effects from medications, such as diuretics. So how do we treat these? Sabi naman, there's high rate of spontaneous remission. So, buti na lang. And we treat, if there's functional impairment. The first step is to review. Review natin how the child toilet trains, how the parents encourage the child to toilet train. So, and it is helpful to keep records, to determine baseline and follow the child's progress. So, may kinatawag silang star chart, it's like reinforcing the good behavior. If for a day they did not pass urine, so bigyan mo siya ng star. May put it in a calendar way. If daily they haven't passed urine inappropriately, so you give them a star there. Okay. So ito yung ginagawa din. Practically, you tell the parents that during bedtime or at nighttime, i-restrict na yung fluids. And night lifting to toilet train the child. So, bago pa matulog, you will advise the parents to take the child to the CR na. Ito, alarm therapy. So, parang wala naman tayo dito, but there's an alarm, attached to the underwear or So, it works by alerting the child to respond when voiding begins during sleep. Parang may alarm, battery operated siya. And it is attached to the child's underwear or mat. So the alarm is triggered as soon as voiding begins Tapos mag-emit siya ng loud noise, ma-awaken yung child, tapos tatayo siya. They will respond to the alarm by getting up and voiding in the toilet. Tingnan nyo yan, may mga images na ganun. Hindi ko lang na-add. If with bowel dysfunction, of course, i-assess natin kung may chronic constipation, which is contributing to the urinary dysfunction, and to consider increasing dietary fiber to diminish constipation. Of course, kung nagko-constipate din siya, full ang kanyang rectal wall, edi mas hindi nakakapasang urine. Ay, mas nagpapasang urine kaagad. So, consider natin yon. And we'll advise dietary fiber. So, meron treatment, pharmacotherapy for the sake of knowledge, but I think we don't have this here, no? Desmopressin, no? It's an intranasal spray. Although there's adverse effects, ang dami, no? Headache, nasal congestion, epistaxis, wrong spelling, hyponatremic seizure, which is the most severe side effect. Tapos may mga antidepressants, the older ones, no, imipramine. No? Yan yung mga first medication, but it has anticholinergic side effects. So, ayaw natin yun. And mula lahat to, actually yung imipramine, wala na eh. Nababasa ko na lang yan when I started training. So, reboxetine, no? This is a norepinephrine uptake inhibitor. Kasi nga, yung mga imipramine, medyo cardiotoxic siya, no? So, itong reboxetine, non-cardiotoxic siya. Pero, wala din tayo yan. So, what we do, yung kanina, yung alarm therapy, that falls on the behavioral therapy. And of course, we do bladder training. No? We encourage or reward the child for delaying micturition, no? And for increasing times during routine hours. And again, star chart. So psychotherapy, useful siya in dealing with coexisting psychiatric problems. Of course, and if there's emotional and family difficulties that arise to chronic enuresis. So we address that. Okay, for example, kung anxious yung child, no? Or is part of the oppositional defiant behavior, so we address that in psychotherapy. So other, usually parts of other specified elimination disorder, syempre, pag hindi nag-fall, doon sa specified, no, doon sa category ng encopresis, enuresis, other siya. Sasabihin nyo lang kung with urinary symptoms or fecal symptoms. Tapos yung unspecified, no? So, again, these are symptoms, characteristics of the disorder, pero they do not meet the full criteria, no? The specified elimination disorder category, halimbawa, hindi na-meet, or insufficient ang information to make a more specific diagnosis about mga emergency room settings, walang informant, yan. Pwede natin ilagay yan, unspecified. Okay? Tapos na. Very short lang talaga siya. Isa siya sa mga short, isa siya sa mga